Welcome to this interview. My name is Dr. Emilia Frigovic. I'm general practitioner and psychiatrist, and I have the honor to interview here very special persons, therapists, and persons who have great gifts and astonishment results in the healthcare sector. Like today, I am very proud in having here Dr. Adel Rayess. We are here at the conference, the EGD-Med in Vienna, and I heard today your speech. It was so impressive, so I'm very lucky to have you here right now. Thank you for your time.
Thank you, I'm honored.
Thanks. Well, I will just introduce Dr. Adel Rayess to the audience with a few sentences. Dr. Adel Rayess is osteopathic medicine doctor and brain stimulation specialist. He graduated from the University of Lugano, Switzerland, so we have this in common, Switzerland. I was there too. Yes, and he has more than 20 years experience in treating patients with very different physiological problems in the body. He is specialized in the spine treatment. He has a private clinic in Lebanon, and he is very famous there. And just today you told me that at the airport some people here in Vienna came also to you. They recognized you, so it is very difficult in getting a treatment because you have a very long waiting list. Yes. So thank you very much, and I would like to ask the question, well, what is your special treatment strategy?
Well, actually, thank you for receiving me. It's an honor. Coming to Vienna this time was very special. I had the privilege of giving a small speech. It was like an hour, a bit short, but I hope I delivered the message. So, in let's say in resume, what I do is I specialize in treating hopeless cases when the normal medical field or the normal medical staff says, I cannot do anything for you anymore for these cases. These are chronic cases such as chronic back pain, neck pain, any kind of pain, and also neurological diseases such as MS, ALS, Parkinson, hemiplegia, whatever, fibromyalgia. I'm very skilled in treating fibromyalgia. And the thing is, the success that I have is by the results, as simple as that. So once you give results, you have success, and success brings you fame. I never asked for the fame. I only wanted my patients to get better because there is a big cause for that. I was a patient. And I suffered a lot because I had an accident in the mid-90s, so almost 30 years ago. I broke my pelvis in 3 places, and this resulted and twisted my coccyx as well and dislocated my right shoulder. It was a ski accident, and this resulted in chronic pain. And can you imagine a young man who I used to be a huge bodybuilder as well, and preparing for competitions, international competitions, and 1 second all my, let's say, bodybuilding dreams went away. Yeah. And I stayed on a wheelchair for a nice period of time and was treated by anti-inflammatory and pain medicine, let's say. And there was 0 results. And then they went to steroid injections, 0 results, and did, let's say, hundreds of physiotherapy sessions, and hydrotherapy, and acupuncture, and nothing worked. And due to the fact that I took so much, they gave me so much anti-inflammatory, I was still a student in the medical field. This created that I had hypertension.
Oh.
And I still have the hypertension till today because of all the anti-inflammatory that they gave me. I took, I think, more than 200 boxes of anti-inflammatory. And so I got to a point, frustrated to a point where I'm living in pain all the time. It was hell. And all of a sudden, the boss of my father worked in a factory, and the factory owner knew about my case and how desperate I was, and with all the pain that I had, I couldn't walk for 3-4 steps.
Wow.
The pain in my back was 10/10. So he decided to send me to an osteopath in Switzerland on his expense. So I said, yeah, why not? I'm in pain all the time on a wheelchair. All my muscles went away. So why not? Yeah, I will go to Switzerland on his expense. And I didn't know what was osteopath. Never heard of it before. So I went to this osteopath, and he examined me in a very weird way, because when you go to a normal physician, normal doctor, they see your x-rays, and then they tell you lay on your stomach, and they just press on your back. You have pain here, you have pain here. Okay, take this medication.
Yeah.
So he examined me in a very weird way. He asked me a few questions, and then he was putting his hands on me and mobilizing me without asking me if there's pain or not. I was a bit surprised.
Yeah.
Why isn't he asking me if I was in pain? Yeah. And then he said, lay on your side. And then he put his big hand, on my pelvis, and then I heard a loud sound. Bah! Something cracked. I was shocked. I was scared.
Yeah.
I thought that he broke me. So I was shouting on him, and he said, calm down, just wait for 5 minutes. And then I was so furious, so I went up, I got up, and then I went to my wheelchair, and then I realized, man, I'm walking.
You're walking, yeah.
I look at him, he was smiling. I thought, what kind of sorcery, witchcraft did he do to me? And then he explained the principles of biomechanics and the difference between the normal medical world that relies only on images and prescribing medication, and the real treatments that modern medicine have forgotten, because they rely only on what the big pharma tells you to do. And I told him that I wanted to learn osteopathy. I fell in love with it.
Wow.
And this is how I started my journey. This osteopath later became my professor. I went, and it took me 2 years, so I graduated first from Lebanon, and then I did my specialty in osteopathic medicine in Switzerland, and they had a scholarship from the Swiss government to do that. And this is how we started. Then what we were taught in the university was a bit different from what my professor did to me when I was his patient. Because they teach you a lot about anatomy, physiology, biomechanics, but they do not teach you a lot about how to use your hands and the connection between the mind and hand connection. This is very important, because the human hand took millions of years to become like what it is today. We started as primates. Let's put religion on the side. Let's talk science. Yeah. We started as primates, and with evolution, we can now use our fingers And when we started to use our fingers and hands properly, this is when we started to do technology. Like the wheel is technology. Animals do not have a wheel. Animals do not carry wood sticks and create fire. Okay?
Yeah.
So the first true technology was the human hand. And you can use the human hand to kill, and you can use the human hand to heal. So human beings, they prefer to go into violent things, create war. In all human history, you see that they created war more than peace. But you can still use it to make good. And if you really teach your hands to feel what's going on inside the body, then you can do wonders to the human body. It took me precisely, this is my 28th year, to really master the art of treating people. And the treatment is easy, is the diagnosis that is difficult. Anyone can do a crack or a torsion. Anyone can do it. Open the social media, you'll see people cracking other people in a ridiculous manner. But to do a proper diagnosis, this is the difference between success and just making a living. Success is giving results. Results is finding a problem and treating it. So this is my story in short.
Yes.
It's the diagnosis. And the diagnosis, I was inspired by a few legends, let's say, who passed away in osteopathy, Americans, mainly Americans. One of them is the late Dr. Fulford, who was a phenomenal person, and Dr. Philip Greenman as well, who passed away not long ago in 2009. And I was inspired by their work, and then I did my own research. So my research was done in the morgue, because I used to work in a morgue as a morgue technician, just to get my pocket money when I was studying, because scholarship did not last long. Scholarship, they gave us a few hundred francs per month, which is nothing in Switzerland. It was and still very expensive. So I need to work to earn my living, and this is how I got to do my work in the morgue, the experience. Then I found that while dissecting, there was always a problem, one big problem in the fascia in each human being. And the problem is that when you cut the fascia, it's a layer like this, you cut it with a scalpel, okay? It should cut very smoothly. A lot of times you cut and then it stops. And the scalpel does not cut. You need to force and force and force and force to cut. And I noticed that each person had one particular point in his fascia that was different from all the rest. And this intrigued me, and this was the primary lesion, the first trauma that occurred and changed the anatomy of this person. Primary lesion can be from your first breath, when you enter this life, an incomplete first breath can create a primary lesion in your rib cage. Let's say when you were born, if you don't cry, okay, to expand your rib cage, because you are breathing through your stomach, umbilical cord. So if you don't cry, This will not expand. And if it doesn't expand, your rib cage, okay, you will have low oxygen intake during your life. And this is a primary lesion. Okay? So rather than living 80 years, you will live for 50.
Wow.
This is a small example.
Yeah.
When you fall when you're a child, and you know that how many times did we fall when we were children? And your parents, oh, you're okay, be a man for the boys. And for the girls, oh, daddy, come, you're okay, princess, go. Those traumas they remain in the human body. And a primary lesion is a dysfunction in a specific joint where it will interrupt the normal activity of the joint. What is a joint? The only, let's say, role for a joint is to do a movement. Okay? God created the joint to do that.
Yeah.
If this joint cannot perform a specific movement in a three-dimensional way, so this will create an impact in the fascia and the ligament, and this will create an impact in the muscle, thus the microcirculation. Thus it will spread, okay, year after year after year, and this will affect other organs. And this is how we become sick. I'm not saying sick by getting an viral infection. No, I'm talking about chronic sickness. And medicine cannot do anything, normal medicine, for that, just prescribing pills.
Yes.
Take this antidepressant for life. Take this anti-inflammatory for 6 months. Take this and take this. This doesn't work, take another pill. If the pill doesn't work, take this shot. The shot doesn't work, let's cut you. I'm not criticizing modern medicine. Sometimes I do refer patients to surgery when they need it, when they really need it. When does a patient require spine surgery? When there is paralysis or the paralysis has begun. This is the only time where you should do surgery.
Okay.
If you don't have paralysis, the body will heal. You just need to know how to manipulate the body to help help Mother Nature do its work. We have been on planet Earth for 1 million years, maybe more. How did we survive? We didn't even have paracetamol.
Yeah, incredible.
How did we survive?
Yeah.
It's human nature. The body has healing powers. It can, for example, let's say I cut my finger now. Okay? So we sterilize it, we put bandage, and we put tetanus shots and penicillin shots, okay? All the modern things of big pharma. And after a week, it's healed.
Yeah.
Do you think that the tetanus shot or the penicillin shot or the iodine or the did the work? No, it's Mother Nature did the work.
Yeah.
Okay?
That's beautiful. Yeah.
So all you did is you helped Mother Nature. And this is what I do. I help the body to get better. Okay? It's like a key. You put on the key in the door and it doesn't open. Just put some oil, help this key, and then it will open. I give you another example, how to find a primary lesion. Competitors, I will say, not colleagues. Because if they consider themselves colleagues, they wouldn't say these words. Competitors criticize sometimes, how are you doing this? Or it's fake probably, or I don't know. When they say it's fake, it's the biggest compliment for me because they cannot achieve this level of results. And they will never dream of it. So I will tell them, look, if you want to put light in the room, all you need is the switch and to do a very simple movement, click, and you have light. But if you only hit it here, but if you hit here, if you hit the wall, if you hit on the wall, if you don't hit this particular switch, you'll never have light. And this is how we do the diagnosis. Finding the exact lesion, treat the lesion, and leave Mother Nature to do its work. This is why when I do the treatment, I tell the patient, lay down for 20, 30 minutes. Don't do anything. Just lay down and close your eyes. Okay? Because the nervous system or the brain is in shock, positive shock. And then after 30 minutes, I'll go back to the room and tell, stand, or walk. And this is where they get shocked.
Yeah.
I don't finish my treatment and tell them to walk. I give them like 20, 30 minutes all the time. Leave Mother Nature, leave the life force, the blood flow, the nervous system, the cells, everything to start working again. And now we use also neuromodulation. And this is helping a lot, where sometimes we had a few problems with the results or very, very difficult cases. Now neuromodulation is helping to achieving even farther, greater results also, because now we can work spine and brain. So all the nervous system now can be worked.
Yes. Great, great. It is very admirable. Today I was able to watch. You demonstrated some patients where you did the examination, and it was very astonishing how you, with only a few touchment points, you discovered the original primary lesion. So this was very great. How many years of practice does somebody need for being able to examine that?
Well, I graduated in 2005 as a normal osteopath. I would say I was okay. My level was okay. Let's say on a scale of 1 to 10, I was a 6. And it took me to educate my hands some years. Yeah, you know, I achieved a good level in 2019, meaning after I graduated, 14 years after I graduated. And the ultimate, let's say the ultimate level was achieved recently, because each year my level goes up, I can feel more.
Yeah.
Because you're educating your hands, just like a surgeon who educates his hands to become a skillful when he does surgery. The more years in his practice, the more skillful he has. He cuts in a better way. Just like me, it takes a few years each time to find the deep problems in the human body. So yeah, it takes a lot of time to educate, to really know how to examine a human body. Let's say, let's examine all his joints in a 3-dimensional way. It's very important to examine in a 3D way, okay? Because there's nothing, the 2-dimension will not give you any results. It should always be a 3-dimensional, and sometimes it's a 9-dimension. It's a 9D, yes. When I examine the occiput, it's never in a 3-dimensional way. It's always in 9D. In all the dimensions. This is very important. Some joints you cannot examine them in 3D. Let's say the coccyx. The coccyx can only be examined in a 2-dimensional way, because it should be fused. It's a fused joint, so you can only examine in a 2-dimensional way. So other joints can be examined and like the occiput in a 9-dimensional way. And the rest is in a 3-dimensional way. So the success is to do a proper exam, and you need to double check and triple check each time. Okay, let's say I examine the patient. It takes me 2 to 3 minutes to examine a patient now. When I started, it took me 35, 40 minutes. To do a real good exam.
Yeah.
and now it takes me 3 minutes.
Wow.
To do a full exam of all the joints. We start with the occiput, with the TMJ, and then we go all the way to the feet. I do not examine the skull bones or cranial osteopathy because it lacks a lot of, let's say, scientific evidence still to be proven that the temporal bone does a rotation. I will not go into this field a lot because other osteopaths swear by the cranial osteopathy. I didn't find it very convincing for me or the patients that I only put my hand here and my back pain will heal. Okay, I can feel, or some people tell me that they can feel a shift in the temporal bone, or it's all about fascia. So if you feel a fascia spasm or a problem, usually fascia, when it has a problem, it becomes like a spider web. So when you detect this spider web lesion, this is an anatomy problem. You cannot describe it by a temporal bone that does rotations, or a liver that is up or down, or so cranial osteopathy and visceral osteopathy needs more scientific proof. But when we talk about the joints, there are so many research, and you can see my results.
Yes. And they are very impressive. You are very successful with your treatment. And what are the main conditions which are being proven or bettered? Like back pain, I think, yes?
So neck pain, back pain, this is, or we already know that. Any kind of pain that is related to musculoskeletal dysfunction. And especially fibromyalgia, we have a lot of success in fibromyalgia.
Wow.
And any disease that modern medicine cannot find a cause or a treatment, we can interfere.
Like migraine, for example.
This is easy.
Today, yes, really.
This is easy to treat. Yes, I don't know why people put migraine like a stigmata or a this is one of the easiest problems to treat.
Wow. And what is the cause of migraine? Like also a primary lesion? And
everything is a primary lesion. Everything has a cause and primary lesion. The primary lesion detection can be used in all aspects of medicine before you do any other treatments.
Wow.
Okay? Always find that you have a problem. Okay, and then you have a disease. The problem is a primary lesion. We all have it. Okay, sometimes you have more than one. It's rare. Sometimes I find more than one primary lesion. Okay, let's say, for example, we find it a lot in countries where they have wars, because they have the PTSD, and they have the physical shock. Let's, for example. I treated not long ago an American soldier who retired. His wife is Lebanese. So he was in Iraq, and they was in their car, and they blew up mine.
Oh, okay.
Okay.
Yeah.
This is after I knew the story, after I examined him, because I told him you have two major problems and they are connected. And he told me about the story. So when he got a PTSD from the shock of the bomb, and then when he flew and hit the ground, that was the physical shock.
Okay.
So he had two major primary lesions. Yeah. Okay, a primary lesion can be anywhere in the body, anywhere. Okay. It can be in the clavicle. It can be in any vertebra. It can be in the jaw, it can be in the pelvis, in the sacrum, it can be in the hip and the knee, and anywhere. It can be anywhere. Okay? You just need to find it. And usually it's the joint that don't move. That is different from all the other joints.
Okay.
This is a primary lesion. It is a stiff joint that doesn't resemble the rest of the body. Okay? Sometimes it is like ankylosed. So it doesn't have any mobility. It resembles a joint of someone who has been dead for 2 hours. That's the exact, if you want to do a comparison, this is how you can find a primary lesion.
Wow.
If you have touched a person who's been dead for 2 hours, you know what I'm talking about.
Yeah.
They start to become stiff after 2 hours, sometimes after 1 hour. Okay? So in the body, there is always one joint that has been probably dead for 2 hours.
Yeah, wow.
And when you find it and treat it with manipulation, HVLA technique, or with any other kinds of therapy, let's say physiotherapy, let's say acupuncture, let's say injections. You can do a small cortisone injection if you like, let's say, although I do not like cortisone injections. You can use prolotherapy, ozone therapy. You can use any laser. You can use shockwave. You can use vibration therapy, stretching, whatever you want. Just find the problem. Okay, fix it. Leave the patient alone for some time, and then do your treatment. As simple as that.
That's it.
You're a physiotherapist? Good. Find the primary lesion, treat it, see how much the patient will become better, and then do your 20 sessions.
Yeah.
Because the patient will, once he feels better, he will trust you blindly.
Yes.
Okay? So some physiotherapists are afraid that if we do this primary lesion, we will be out of work. No. Just do the primary lesion, get him better, and do your treatment. Do 20, 30 sessions, whatever a physiotherapy tells you, or chiropractors, or any other kind of therapy. So don't leave this problem, because you will never have a result. Never. Or if you have some result, it will be a very temporary result. Okay? And then the problem will go back. Because you did not fix the domino effect. Always treat the problem, never treat the symptoms. Don't act like medication. If you want to act like medication, don't work in the domain of treating people. Just do MD, sit behind the desk, prescribe, stamp, and give them.
Yeah.
This is what you want to do? Is this what medicine has become? Just popping pills to everyone?
Yeah, unfortunately.
Drugs. Any kind of drugs have side effects. Just open the box and read side effects. First do no harm. This is the first rule of any healthcare practitioner. First do no harm for the patients. Treat the patient as if it was your father or as it was your mother. Always consider patients as your daughter, your son. If your son was sick, do you want to make him, or do you want to give him something that can make him worse? Never, right?
Yeah.
So why do you accept for a stranger who comes to visit you because he trusts you, because you have pledged your how do you say it?
Have a title or something?
No, because you pledged all your life to help him.
Yeah.
So he comes to trust you, and then you give him pills. I'm not saying you shouldn't give pills. Yes, give an anti-inflammatory for 7-10 days. It's okay. You have people who have been taking anti-inflammatories for 10, 15, 20 years. That's a shame. It's a shame.
Yeah.
Only because you don't want to stand and move your, ASS to examine the patient, a real exam, and finding his problem. Laziness has become sometimes the middle name of doctors. They're too lazy.
Unfortunately.
They're too lazy to just, okay.
Yeah.
Say, okay, you have pain where? Okay.
Yeah.
That's a shame.
Yes, it is. It's also the system which is pressing the people in the surrounding, I think, and that's why I find it so impressive how you analyze very exactly the origin.
Yes, there is no two patients alike. No, there's never two cases alike. You have back pain and you have back pain. You think you have the same problem? No. You have fibromyalgia and you have fibromyalgia. You have a different cause than the other person. No two people have the same cause. Never. Wow. Very, 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 never, ever. Each person is different. This is why the treatment should be customized for every patient.
And then it needs this art of examination, of finding the truth hidden primary lesion. And I have one question. How many treatments does somebody need when you already found the primary lesion? Only one?
One.
And it lasts?
So fixing a primary lesion takes you one session, sometimes two. If it's, let's say he's a 70-year-old man or 80-year-old man who have a primary lesion that has been 60 years in his body, now you need two.
Okay.
But the difference between the first session and the second session is between 45 to 90 days.
Wow.
Because the body needs time to heal.
Okay.
Physically and emotionally. A lot of times when you treat the primary lesion, people start to cry. Not from pain, they don't know why. Or they start to laugh.
Like an emotional release.
Emotional
from this
release.
fascia.
Yes. Always there's a real, or they become angry.
Wow.
Some people become very angry for a few minutes because when you treated this primary lesion, it was due to a PTSD, post-traumatic shock syndrome. So they become very angry, and then afterwards they become very tired, and they feel light, and they say, why am I feeling this? I have, let's say, I have a disc in my back. Why am I angry? Because maybe it was a shock, a psychological shock that created this problem. The problem created symptoms. The symptoms created a disc herniation.
Yes, and the body, we said the body keeps the score and it keeps this memory inside this.
Every trauma that you have stays inside of you.
Yes. Well, this is very impressive. May I ask you if you see also a connection to mental health disorders or some kind of connection also to anxiety or insomnia or depression? Did you experience this?
We see that a lot in fibromyalgia patients. A lot, and they always get better.
Wow.
Once you really find this first original old trauma.
Wow.
And they have, everything changes. So they sleep better, they think better, they digest better,
Wow.
they breathe better, and they are calmer.
Wow.
And with also now, with combining neuromodulation with that, the results are truly phenomenal. I have, it will sound a bit cocky, but because I'm used to seeing these results, we have patients now who a moment they're on a wheelchair for like, they've been on a wheelchair for 3, 4, 5 years. And the next thing, after 20 minutes, they're walking.
Wow.
Not perfectly, of course, but they're walking. Okay? Now it has become something ordinary for us to see these changes in the clinic.
Yeah.
This is not black magic, it's science.
Wow.
Okay? Neuromodulation is pure science. Pure science. And primary lesion, yes, it is probably a little bit of an art, but it is science as well. What do you mean? Because a cardiologist who has a stethoscope and finding a problem just by hearing the heart, this is science,
Yeah.
right?
Yeah.
And the same thing, finding a problem in the skeleton is a science as well. Just need to be taught. It takes a lot of time, but it can be taught. Primary dysfunction, primary lesion cannot be seen on X-rays. Okay? Cannot be seen on MRIs because the periarticular spasm or the spasm of the ligaments, we don't have yet the right technology or the advanced technology to see it. It will come with the advancements of MRIs. Now it's a 3 Tesla MRI. When it becomes like 12 or 16 Tesla, you will see it.
Yeah. Okay.
Okay? You will see it. Or probably with the AI, an AI probably system will examine and find these primary problems.
Yeah.
But I think it will take a bit of time, 10 to 15 years. So for now, we will rely on the human skills.
These ones.
Yes, like the cardiologist who relies on his ears, like the surgeon who relies on his hands and on his eyes, like the dentist who also, it's science and an art as well.
Well, this leads me to the next question. Where can colleagues or people, professionals who are interested in learning your method and learning from you, where can they learn your technique, learn to use the hands and to...
Well, I want to be very honest. I was, a few years back, I didn't want to teach it to anyone because I was happy with my success and I felt a bit cocky and arrogant. But when you become older and wiser, you see that this needs to be taught. This information needs to be spread because if I die, this will die with me and it's a shame. And I'm not an immortal. One day I will die. And this shouldn't die with me. Because I am only one person. Okay, I changed so many lives, but what can a person do as a big change? Let's say 5,000 people, 10,000 people. What is 10,000 people? We are several billion on planet Earth. So this needs to be taught. And I'm starting. It's been the last 3 years with teaching it. So far for our Arab colleagues, because I'm a Lebanese and I work in Beirut. And now we should start to spread it in Europe because I'm getting older. To be honest, I'm getting older. And before we used to see 80 patients per day.
Wow.
Now 40, I'm become very tired.
Okay.
40 patients. And I'm almost 50 years old this year. So I don't think I can see more than 20 patients more per day. So if you do the math, 20 patients per day, meaning per year, it's nothing. So I cannot change people's lives like I did when I was younger.
Yeah.
So this needs to be taught. We need to see healthier people, healthier society that relies more on Mother Nature rather than Big Pharma. Big Pharma has done good, but and then has done bad as well. So many side effects from all the medications, and I am one of these victims. My hypertension is a result from big pharma. So, and how many millions and billions are like me?
Yeah.
So we need to go more into medicine that does not do any harm. But in the same time, teaching a technique that powerful, that does so many great results, needs to be taught only for doctors who are highly skilled, wise doctors, and not fresh graduates. Why not fresh graduates? Because I need someone who has experience with patients, who can feel the pain of patients, not who wants a quick buck, a quick money.
Yeah, yeah.
Okay, use this technique to get more people and get more money. No, I don't want that.
It's not the good mentality.
No. I want to teach it for doctors who are wise, who will want to do some change, and they need to understand that once they know how to find the primary lesion, they will have a lot of enemies.
Unfortunately.
Oh yes.
Yeah.
How do you know how much success do you have? By the number of your enemies.
Yeah. It's so. This is a shame, isn't it?
Yes, it's a price of success probably. And again, I tell you, I never asked for success. All I wanted is my patients to get better, and that's it. But one patient brought 10 patients brought 100, 100 brought 1,000, and now we have 8 months waiting list. It used to be 6 months, now it's 8 months waiting list. And I'm not getting any younger. So this needs to be taught indeed. Dr. Heli Rayess told me that we should spread it. A few colleagues of mine convinced me that we should spread it, because it shouldn't be a one-man show. All the old doctors, they passed away, the ones I told you about, and the knowledge died with them. I was fortunate enough to see one great osteopath that uses a technique that is similar, diagnosis. When I say technique, it's always diagnosis. I never talk about treatment. Treatment is not difficult to do. Once you find a problem, treating it is not difficult. So this osteopath had a very similar technique, but sadly, he didn't teach it. And he had a stroke, and now it's too late. Not now. This story was in the early 2000s. I don't want to have the same history to him. So so far I taught it to a number of people, but the problem is that only 3 knows really how to find the primary lesion out of I think 50.
Really? So it is very difficult to...
Apparently, I find it very easy to, but it's only 47 I have not succeeded in doing it. So it probably needs someone who is really dedicated and highly skilled and calm and probably high IQ, I think.
Yeah.
And to really master the art of examining a patient.
Yeah. So this means you have to teach it to a great number of people for being able to select a few ones who can really use it. Is it correct?
It's either this way that you're proposing, or or a very little number
yeah.
and a one-on-one. Because once you find your first primary lesion, then you get addicted.
Yeah, I can imagine.
You get addicted. Oh my God. It was in front of me all the time and I couldn't see it. It's like this pen.
Yeah.
Okay?
Yeah.
It's in front of me.
Yes.
Okay? And I can only see you. I can see the curtain. I can see the wall, the chair, the desk. But when it was here all the time.
Yes.
It's just a matter of how to use your hand and how to do your mind-hand connection. Okay? I'll give you a small example. I did it in the seminar. So let's say this is a tissue.
Yeah.
Okay? Let's put a lot of tissues, one hair, put it, and start to feel it.
Wow.
This is how you will start to really train your hand to feel what's going on.
Wow.
Okay? Now, if you put a hair and you put not a paper, of course, tissue, because when you're examining a patient, we always examine over the clothes.
Yeah.
That's the golden rule. And in Europe, I see they examine on naked patients.
Yes, always.
So how do you expect to find a lesion that is on a naked body? Because your thermoreceptors are stronger than your mechanoreceptors. So when you feel the heat of a patient, a living patient, 37 degrees Celsius, it's impossible to see what's going on inside. So it's always need to be over the clothes. Okay? So put a hair and put a tissue. Okay? And I can find it easily.
Wow.
Easily. Very, very easily. So you can start to train with that. Once you find the first time you find it, and then you will find it always.
Wow.
Okay?
Wow.
It's because everything is here. I don't have a different hand than yours. Well, it's the same hand. It's the result of 1 million years of evolution.
Yeah.
But I know how to use it better. Just like an athlete who knows how to use his legs. They all train the same training, but always there's one who wins the Olympics.
Yeah.
Mr. Bolt, right? You've seen Bolt, always wins every time. Does he train harder than the rest? He trains the same, but there's a mind-muscle connection. So once you do your mind-hands connection and you know perfect anatomy, perfect physiology, and you know your perfect biomechanics, it needs to have the theory, the science needs to be perfect, of course. It's not like do the palpation. No, you need to be very good in human anatomy. And you need to know the wrong and the right. If you don't know the right, how can you know the wrong?
Yeah.
Okay? And then you can be taught how to do a proper diagnosis.
Wow.
And once you do your diagnosis, then do the treatment. Do whatever you see fits your skills. Any doctor can do it.
Great. So this is such a great message, and you remind us of the origins of medicine, of healthcare, of helping each other only with our tools, with our body. Yes, it is non-invasive. So this is really
medication
great.
is a tool. Surgery is a tool. Your hands are a tool. The surgeon uses his hands to do a medical procedure. Okay, your hands can be more powerful than a scalpel in some pathologies. I'm not saying in a tumor or a fracture or a medical emergency. We're talking about chronic illnesses, chronic diseases, where there is no way to do any good with normal medicine. This is why I tell doctors, why do you criticize me sometimes? You don't do any results for these cases. So why do you criticize? Okay? Modern medicine, normal medicine, or classical medicine have done whatever they can, and those patients are still in pain, are still in disease.
And many of them.
You know, a lot. You have no idea what we see in the clinic every day. I see these pathologies that are so weird sometimes. They have a number of diseases at the same time. Some of them are from a primary disease, and the rest are side effects from the medication.
Yeah, I can imagine.
So you see a person who has been in pain for the last 30 years. He has high blood pressure, diabetes, triglycerides, cholesterol, depression, bladder ptosis. We see it a lot in women because of all the muscle relaxant that they took. They have ptosis of the bladder, and they all the time they have urinary incontinence. They have veins problems, varicose veins. They have osteoporosis from all the cortisone that they took. They have lung disease, all from side effects of medication.
Yeah.
If you have treated this problem 20 years ago properly, you wouldn't have taken all this medication. You wouldn't have costed the state so much money.
Yes.
Imagine how much money we are saving the state.
Yeah.
Let's see if there's a, let's say you're from Switzerland.
Oh, well, I lived in Switzerland. I'm from Ukraine originally.
Okay, but you're in Switzerland now, right?
Now I'm in Vienna.
Okay, so let's say let's say in Austria, if they had 1,000 doctors like me, with all modesty, think how much the Austrian government will save money every year.
Yeah.
How many billions, not millions, billions.
Yes. Yes.
They will save money.
Yes.
Billions of euros every year will be saved.
Yes.
They can use this money to do other things than to spend it on always medical bills, non-stop medical bills. And each time you give anti-inflammatory to a patient, you're creating another disease, a disease that needs other medication. Yeah. Those other medications have side effects that will create another medication, and vice versa, and vicious circle. Yes. All these people are living in a vicious circle.
Yes. No, so this is very bad, and that's why thank you so much for reminding us on how simple it can be when you make a very accurate diagnostic. And this is such a great work you do. It is wonderful. It was very impressive today for me too to see the demonstrations. And I hope very, very much that you will come back to Austria or to these countries too, and maybe provide some trainings. So this would be very great. And I thank you so much for your time.
Thank you for receiving me.
I am very proud of being able to talk to you, and we will put the links. I think you have an Instagram channel and some links to websites, so we can put them.
Facebook, Instagram, TikTok, and YouTube.
Yes, so perfect. Well. Perfect. We will put it there. So thank you very much.
Thank you.
Have a very nice day, and bye-bye.